So I'm Lauren Hudak. So I'm the person who put all this stuff together. But I'm sitting amongst some really great folks in firearm injury prevention. Today we're going to talk to you about how to think about guns and injury prevention, and also how to maybe take some of the lessons that we learned today and take them back to your own institutions, talk to patients, kind of whatever you see important to your life and your practice. So to give you an overview. First, we were going to go through some introductions and then just introduce ourselves, and then I'm hoping to kind of get an introduction from you guys too, and just give us your name and where you're from and what kind of interest you have in firearm injury prevention or just general, and we'll go from there. So, just to give you a big overview too. So we're going to have our didactic session this morning. So a lot of kind of talking and us just giving content to you, just to sort of give us a framework for our discussions. And then, and each one of us are going to do a little piece of this. So you'll have all of us doing this session. Then afterwards, we're going to break up into 3 groups, just since we thought that was the most logical way with folks we work with. People tend to be either research people who really want to focus on clinical and patient discussions, and then also folks who want to bring education and curriculum back to their institutions. So we'll have those 3 groups we can kind of break up into, and then a few of us will moderate with those groups to have a discussion about that. And then we'll debrief, and if you guys do fill out your survey, I'll probably look through it and then just give you a baseline big picture of what our group looks like. And then we'll talk about the afternoon range session, and Jeremy Ackerman will give us an overview during this portion, so this firearm cultural competency and then our range session. So you'll hear a little bit more about that, and we can talk about, if you guys have specific questions about that, we can talk about it as well. All right. So just to get started, I wanted to introduce all of our speakers. So Megan Ranney, so she's from Brown. She also has a bunch of research support and is the chair of the ASEP subcommittee on firearm injury prevention. She's the chief research officer of AFFIRM, which is a relatively new group, the American Federation for Firearm Injury Reduction in Medicine. And then she's also one of our SAEM board of directors. So she kind of has her toe in everything and is very much involved in this, and has also been on podcasts and does lots of really great things. Pat Carter, he's from the University of Michigan. He's the assistant director of the Injury Center. He also has lots of funding in firearm injury prevention, and also works with one of our keynote speakers that's speaking tomorrow, Rebecca Cunningham, and him both work very closely together and do great work, especially in pediatric firearm injury prevention. Marian Betz is a wonderful collaborator from the University of Colorado. So she actually has helped a lot with even our Emory Center, the work we do at Emory. We've modeled off of Emmy's work. She has a lot of research support, especially in lethal means counseling and suicide prevention. So she's a wonderful person in that field. She also founded the Colorado Firearm Safety Coalition, which is kind of how we're modeling some of our work in Atlanta. So I'm Lauren Hudak. I'm from Emory. I also have just an internal funded grant to look more at patient perspectives and how to talk to patients about guns. And I also work with Henry Schwimmer, is one of our students that's here. That's great. And then I forgot to mention was Displayer. How do you say your last name, Will? DeWispelair, yes. So we've had 2 great students that have worked with us on this work as well. Jeremy Ackerman is our firearm content expert. So he's the one that does a lot of the range sessions. He is also a really smart guy. So MD, PhD. He is Emory and Georgia Tech dual faculty. He has lots of grants to look at either technology-related work, and he has an interest in firearm both knowledge, content, expertise, and working on range sessions. He's also in the police academy right now, so he's kind of into SWAT and tactical EMS as well. So we wanted to acknowledge some of the folks that have really been great to help get this knowledge about this workshop out. So some of the AFFIRM group, including Nikita Joshi and Regina Royan, have been helpful to kind of tweet out some of this content. And we mentioned Henry and Will have both been really integral in getting this session going. So with that, I was hoping to kind of learn a little bit about you guys and sort of see what kind of folks are here and what sort of content you want. So if you don't mind, we'll just go around kind of briefly and just say your name, what institution you're from, and then, if you have a specific interest in firearm injury prevention, or if it's just general, or if there's something you're looking to get out of this workshop, we'd love to hear about it. So I don't want to put you on the spot because you just sat down. So how about we start? How about Henry? Do you want to start us off?
I'm Henry Schwimmer. I'm a fourth-year medical student at Emory. working with the Injury Prevention Center there on mostly firearm injury prevention work to build a career in this field. It's really been important to me for the last 5 or 6 years, so it's great. Excited to be here.
Hi, Ross Fleischman, faculty at Harvard, UCLA, in Los Angeles. Interested both in bringing back some educational interventions by institution as well as doing research, thinking about trying to assemble some local Los Angeles-based data from a number of sources on firearm injuries.
Awesome.
I'm Andrew Kidder. I'm from Bethesda Deaconess Medical Center in Boston. I'm also a program director for the residency there, and I'm working on also educational curricula for mostly physician competency and firearm safety practices.
Hey, I'm Eric Rowling. I'm from Brigham Women's in Boston, Massachusetts. Done some work locally with Mass Medical Society. We convened a recent roundtable with basically every academic institution in Massachusetts and done some work around what people are doing. Work with the team here at the firm, and then also we just got a grant to do some screening and counseling of patients in PD. So we'd love to hear from everybody about what you're doing and how you're using it.
I'm Will DeWispelaire, 4th year at the University of Colorado. I'm working with Dr. Betz and the rest of the folks at Colorado about firearms education, legal means, counseling, physician education, and firearms. So I'm interested in keeping that going. Part of my career is emergency medicine.
Awesome.
I'm Lauren Sutherland. I do geriatric emergency medicine at Ohio State, and I'm here to steal your best practices, and also because the only guns I've ever touched have been in video games, so I felt I should do something to broaden my horizon.
Awesome. That's great.
I'm Courtney Jones. I'm from the University of Rochester Medical Center, and I'm an injury epidemiologist by training with a particular interest in geriatrics. I also teach an injury epidemiology course, and normally we have a guest speaker give the firearm lecture. It's just not the content that I would like to provide, and I have no formal training. So there I am.
Awesome. Welcome.
I'm Mike Nana. I'm one of the assistant program directors at Rutgers, Newark, New Jersey. I have no formal training in this. Like you said, just kind of take it all in and try to learn from you guys. I am trying to start a project on pediatric and adolescent perspectives in injury and firearm injury. So love to hear some of these. I'm looking to steal your ideas. So
We love you to steal all our ideas. That's great. Okay.
Bradley Hess. I'm in Omaha, Nebraska, at Creighton University. I work at 4 different emergency rooms at Moonlight a lot, and so I see a lot of different firearm injuries. One of them is an hour away from Omaha, small town. A lot of those are accident-based, hunters, farmers, kids. I'm interested in firearms. I have quite a few.
Yep.
I conceal carry. I do tactical classes.
Awesome. Are you coming to our range session this afternoon? To put you on the spot. No, it's okay. No worries. No, it's okay. No, it's okay. Just when I was like another instructor, maybe. Okay. Yeah.
I'm Patty Simmer. I'm an MS1 at the University of Chicago. I'm one of the MSAs here, MSA this year. And being on the south side of Chicago, I've been exposed to more hearing gunshots and seeing gunshot wounds in the ER than I have been growing up around Ann Arbor, Michigan. So I'm really interested in learning how to kind of broach the subject with patients,
Yeah.
especially when they may have been exposed to this kind of gun violence since age 8,
Yeah.
and this is kind of their world. And so
That's great.
Hello everyone, my name is Christy Williams. I'm a rising M4 at University of Illinois, also in Chicago, and I'm here because I'd like to learn more about the research happening in this space, particularly as it relates to how we go about patient education and patient safety around this topic. I've also for the last few years been involved in a nonprofit organization whose mission is to reduce violence among youth in the Chicagoland and Northwest Indiana area, so hopefully I can take some of what I've learned and implement some of the program.
Hi, Victoria Wadman. I'm a rising M4 at the University of Nebraska Medical Center. I have a background in global and public health, and I have an interest in disaster relief and injury prevention.
Hi, I'm Sean Flanagan. I'm a first-year medical student at the University of North Carolina. I think I'm interested in violence and injury prevention. It's something I think I want to start pursuing, or at least looking into, particularly with road traffic injuries. overview to more broadly and seeing firearm injury prevention as well.
Awesome. Great.
I'm Sophia Span. I'm from Midwestern University in Arizona. I'm an MS1 there. I worked a lot at UCI Medical Center in Southern California and saw a lot of gun violence there, so I thought it would be interesting to come here.
Great.
Hannah Day, I'm an MS1 in Georgetown. I'm the MSA working this session, so it's open to options and asking questions or questions. I have a general interest in the field and just excited to learn about the steps that are being taken to address this important issue.
Awesome. We can come over.
David Van, I'm faculty at the Columbia American Presbyterian Program in New York. We're actually in an area that is seeing less, I think, firearm violence than at least in the 90s and the aughts. Nevertheless, it's a topic I've been interested in, but never pursued in an academic sense. Wondering what the possibilities are.
Great. I don't know if you want to introduce just your name, your institution, and what your firearm interest is, if you have any, or just general. That's it. Yeah.
Yeah, I'm Jennifer Hernandez-Meyer. I'm non-clinical research faculty at the Department of Emergency Medicine at the Medical College of Wisconsin.
Awesome.
I do public health research, and we have quite a few papers on firearm policy.
Oh, great.
So coming from public health, I'm new to emergency medicine. I want to learn how you guys talk about firearm
Awesome.
violence.
Well, great. Thanks for coming. Okay, and that back table, we totally missed you guys, so I don't know if anyone wants to start off. Yeah. Yep.
I'm Nick Federico. I'm a writing fourth year at the University of Connecticut. One of the MSAs here. This session has kind of caught my interest. I'm interested in firearm safety and more about ways to prevent you.
Awesome. Welcome.
My name is James Fraser. I'm Australian. I work for the New South Wales Ministry of Health. I am an emergency physician who's been in critical care position for the last 25 years. I was in the Australian Army in the 80s and the 90s as a medical officer, but I would only see about 1 or 2 gunshots a year in a large trauma centre. And I'm here to understand a bit more about firearms generally. I'm familiar with firearms personally. And I'm also particularly interested in why there is so much gun violence in the USA compared to places like Australia.
Mm-hmm.
We have pretty strict gun laws, but our guns are fairly readily available.
Mm-hmm.
And I'm trying to understand whether it's laws or whether it's availability or whether it's culture or what is it.
Mm-hmm. Great. Welcome.
Shane Trevithick. I come from Sydney, Australia as well. I'm the medical director of Care Alliance at New South Wales Ambulance Service and also work for an institution at the Penn Hospital. I'm the most likely doctor in New South Wales to see a patient that's been shot. But even then, as I said, we see one every year, maybe.
Wow. Gosh.
But that's why we need to understand more.
Yep. Wow. It's fascinating.
Our practical experience is a lot higher.
I'm Cyrus Smain. I'm a second year going to third year medical student at UC Riverside. And I'm interested because I have some family members in the military and family members in law enforcement. And have seen guns around, have gone to the range with my family members, but don't necessarily have experience or a deep knowledge of that.
Awesome. Welcome.
My name is Harry. Third year going to fourth year at Howard University, Boston Medicine. The reason I'm here is because I've been doing research so far with the violence prevention and review using a national calendar.
Wonderful. Awesome. Well, that's great. Well, we have, wow, quite a assortment of experience and interest. And so hopefully today we can go through some of those things for you and see what this workshop can offer you in terms of skill building and be able to give you the content that you need to kind of move forward with your goals. So with that, I hate to put Megan on the spot because I know she like literally just got here. But it's we're going to start off with Megan just giving a general overview so we have a good framework on some of the data and some of the major issues for the United States. So we'll start with that. And yeah, and so welcome and thank you again for introducing yourself. It was great to hear about all your work. Okay.